I'm going to talk today about spiritual emergence, and that might be a term that you're not familiar with, but I'm pretty sure as past life regression therapists, you're familiar with what it is. And in this talk today, I will be giving you kind of an overview of what spiritual emergence and what spiritual emergency is. And then we're going to do a little mini group regression. And I'll ask all of you to go back to an experience on your own journey when you had what was a spiritual emergence, so that you can remember the flavor of your experience and then have it as an overlay for the information I'm going to share with you today. So you can acknowledge the part that this has played in your own evolution. And we don't have time for everybody to share, but I'm going to invite you to chat with each other and to maybe type out a few sentences of what the essence of your experience was, so that we can see the diversity of all of our experiences of our own opening spiritually. And then we'll go into the content. I'll go over all the information with you. I'll give you a lot of resources for your personal perusal and maybe for your clients as well. And then we'll have time for questions and answers and comments. And I'm going to end with a little blessing for everybody to take this and let it magnetize your practices in your lives. So here we go. So what is spiritual emergence? Spiritual emergence refers to a process in which a person expands with ease into his or her spirit self without a crisis. Anyone who does regression therapy, anyone who's working with psycho-spiritual processes, anyone who has a spiritual practice is most likely going to have points of development where there is a spiritual emergence, where there's a shift, a dramatic shift. And sometimes these shifts can turn into emergencies. And emergencies become a personal crisis that looks like psychosis from an external perspective and is often confused as psychosis when people go to traditionally trained medical practitioners. And I'll go over a whole list of symptoms that are going to be compared and contrasted between a psychotic episode and a spiritual emergence. So you can see there's very similar aspects to both of these. And unless you're trained to diagnose, you're probably going to need to refer someone out to a practitioner who can diagnose legally if there's a spiritual emergency happening. In a spiritual emergency, people are often dissociative, they're non-functional, they're confused, they're worried, they do not get mirroring from people outside of them because people don't typically understand these experiences, and it can be very, very painful and very disruptive unless it's handled with some support that has an understanding of what's going on and can support the client through this emergence process. Often, if people are given medications, the whole emergency and evolutionary process that's going on is thwarted, and it becomes problematic. So I'm going to talk about all this today and give you some client examples, and hopefully you'll be able to take this template and relate it to your own journeys and the journeys of your clients. So how is a spiritual emergence caused? Well, the first thing is the time of life. A midlife crisis is a perfect time when this might happen. A midlife crisis is a typical frame of mind and body that I see my clients in, who are saying, I've done it all. I've made the money, I've had the success, I've had the family, and now I feel empty, and what's next? What is my life about? What's my purpose at this point? And there's a sense of malaise and a sense of depression sometimes because they just don't have the energy to keep producing in the way they've produced in their life, and they want something that's more meaningful. In my own practice and in my teaching, I see people like this constantly, and people who show up for trainings in hypnotherapy or energy therapy or shamanic trainings, which is what we offer, are often in this state. They just want something more. They're looking for something with heart and meaning, and they want community to share deeper aspects of themselves. It can also happen by an archetype of what's called a dark night. This is a term that was developed by a Spanish Christian mystic, And the dark night relates to a crisis where all of your beliefs in the divine, all of your paradigm around God crumbles. And everything that was working for you in terms of your orientations, your belief systems, no longer have any purpose for you or meaning for you. And it's a very painful, deep time. People write about these experiences. One of my teachers right now is a woman who lost her daughter, and her daughter's death threw her into this really deep, dark place. Even though she'd been very spiritual, had written a lot of spiritual books, she had lost her way in this darkness. And she had to work her way through it and come out of it. And she did in a whole new way. She developed a whole new relationship with herself and with spirit. And then there are people who are just in an existential crisis, who just don't know why they're here, what the purpose of life is, and need to find some way to give life meaning. And these spiritual experiences will often open the doorways for new ways of being in their life. And then there are people that have a spiritual emergence through a spiritual practice, a meditation practice, a yoga practice, a prayer practice, even a Tai Chi practice, can be a opening and cause a shift that's so sudden and dramatic that people go into a spiritual emergence. Something dramatic changes them and changes their life and their relationship to their life and their understanding of life. And then people who have physical distresses, illnesses, giving birth is another one. But you have a physical shift energetically that is causing super stress and crisis. And then there are emotional stresses due to encounters with life adjustments. I'm in California, where there's been a lot of really horrific results of the fires in people's lives. And I've been working with a family this last year who lost their home. And it was the jolt of the anxiety and the unknown of what was going to happen in their lives next that brought them to a new level of opening and being receptive to more spiritual aspects in their life, given them a rebirth process. And then the transformational psychologies and therapies that we work with can be openings. You've probably had clients who've had dramatic shifts, even in one session, where they don't feel the same after they do the work. They have a different way of resonating with themselves, of looking at life, of experiencing the reality of their daily lives. And it can also come through Kundalini openings, through sexual experiences that are very intense, or drug-induced work, whether it is recreational, or if it's prescription drugs, or if it's some kind of guided medicine work with substances. Those can often be a catalyst for a spiritual emergence. So now I'm going to ask all of you, if you're interested in doing this, to do a little meditation. And this meditation is going to be a little baby regression back into current lifetime, to a time and place when you had one of these openings. And you may have something in mind already, but it might be that your unconscious will bring something to mind for you as a way for you just to get a sense of your own spiritual emergence process and your own journey. So if you would like to do this, just get yourself comfortable. And to make sure your mics are all turned off. I hear somebody's mics rattling around there a little bit. And when you're ready, close your eyes. Take a deep breath. And become aware of the space between your feet and the floor. Become aware of the space between your hands. Become aware of the space between your in-breath and your out-breath. Become aware of the space between your shoulder blades. Become aware of the space between your thoughts. Become aware of the space between the top of your head and the ceiling. Become aware of the space between your heartbeats. And as you become aware of space, you can move back through space and time, moving back to a memory, event, or experience in your current lifetime where you experienced a spiritual emergence. Allow the space to be filled with your memory of this experience. Let all of your senses awaken to it. In this experience, how old are you? In what environment did this experience happen for you? Step into this environment and step into the body at the age that you were when you had this experience. And revisit it by being present with it, embodied in it. Notice as you have this experience, if you are alone or if others are present, who they are. And if others are present, how aware are they of the experience you're having? Or are they having a similar experience? How does your body feel in this experience? What's the energy in your body like? Or the energy around you? And as you move through this experience, what do you see internally? What do you see externally? And as you move through this experience, what do you hear with your inner ears and your outer ears? What preceded or precipitated this event? And in what ways is your experience of knowing affected? What aspects of this spiritual emergence are out of your ordinary realm of experience? How long does your experience last? And with whom, if anyone, do you share this experience? If you share the experience, how does this person respond? What does this experience change about your daily life and your daily routines? And what does it change in terms of your motivations, your mental, and your emotional states? And having had this emergence experience, how does it affect your sensitivity levels as you go through your daily life? Now, become aware of the space between this past experience and your present life, and move back into the present here now in your physical body. And from this current state of awareness in the here and now, look back to this emergence experience from your present day consciousness. What long-term effects have resulted from the spiritual emergence experience? How are you different because of it? And what has this experience taught you that you've integrated into your life? So in a moment, when you're ready, you can bring yourselves back into wakeful consciousness. Okay, so because we are spirit-based in our practice, we work with soul energy, we work with quantum fields, we work with higher selves, we work with spirit guides. We are very likely to have clients who are in a spiritual emergence or might even start a spiritual emergence through the work that we're providing for them. And our focus is spiritual in nature. So obviously, if someone's having a spiritual experience, they're going to look for someone who has a spiritual orientation. We work with non-ordinary states, and non-ordinary states is by far the best way to support someone through this work by giving them inner resources, giving them meditation practices, giving them grounding exercises, supporting them in developing a relationship with their bigger self is really important through this spiritual emergence process. And the client in spiritual emergency is asking potentially for referrals for other practitioners who will be sensitive to the effects of a spiritual emergence and will not treat it as a psychotic break. So as a practitioner, it really behooves us to reach out into our spiritual communities to find practitioners we can refer to for medical treatment, for psychological care, for Kundalini openings. There are people who specialize in all of these areas that can be hugely of service to people who are going through these openings. And I'll give you some references and referrals for things like that. Next. How do we define a spiritual emergence? Well, these are some very definite aspects of it. The first is people report unusual experiences and unusual perceptions. Many of them do not have to do with 3D reality. They may see a spirit, they may hear a guide, they may have a vision of some kind that comes to them that is not a normal experience in their day-to-day life. Some of the ways that people have these experiences are through psychic perceptions. The first one is clairvoyance. Clairvoyance is clear seeing. And clairvoyance can happen with the inner seeing, like a vision that you have in your mind or your head. And it can also happen in an external way. People who actually see ghosts, for instance, physically see them. And clairaudience can be the same. When someone has an inner sound, an inner message, or an outer sound, internal or external, subjective or objective. My brother-in-law had a very dramatic experience of clairaudience when his mother passed. He went home the day that she died, leaving the hospital, going home. When he got in the house, there was harp music playing, which he thought was quite appropriate. And he thanked his wife for putting on the harp music on the CD player. And she said, honey, I don't even know how to use a CD player, and we don't have any harp music. So he was having a clairaudient experience that for him was mind-blowing. That was part of his emergence. His mother's death brought him into a spiritual emergence. And not only that, but he'd had a clairvoyant precognitive dream that he was meeting his mother and father in heaven, and they were showing him their house, When he came out of that dream, he was sobbing, knowing that his mom was going to pass. And 2 weeks later, she passed. So those are examples of someone who has experiences that are totally out of his daily realm of experience that catapulted him into a new level of consciousness. So I'm just giving you some ideas of how this might work for us, and it certainly did for him. And clairsentience has to do with feeling it in your body, feeling it emotionally, having a knowing, a clear sense of it physically. And the experiences can also be psychokinetic, spontaneous healings, objects moving around you, feeling profound levels of strength and energy. One of my students described an experience of having 2 little kids in the car on a hill where the brakes failed, and the car is going down the hill with her kids in it, and she's out of the car. And she literally hopped over a fence, hopped over a car, and grabbed the handle of the door and got in the car in time to stop that from going over a cliff. And she has no idea how she was able to physically do that. So that psychokinetic energy took over, and she had this amazing experience of saving her children. And then, of course, there are spontaneous healings that people have. And with a spiritual emergence comes a newly sense of knowing or knowledge that was not priorly available to people. For instance, knowing that you don't die, knowing that we're all connected. These kinds of experiences are very transformational and change our sense of self and our sense of what life's all about. And sometimes there are some delusional type of experiences because you identify very strongly with archetypes or themes or mythologies. For instance, one of the archetypes that I resonated with through my own emergence was the archetype of the Bodhisattva vow. I don't know if you guys are familiar with the terminology, but it's a Hindu terminology where instead of giving up incarnating, because you've transcended and are enlightened and move on, you commit to coming back to serve, to help people. And for me personally, that was an archetype that really resonates with me. And I've had this passion for my work and this commitment to keep doing it because of that archetypal pattern that I so deeply recognized and resonated with when I was actually quite young. So maybe for you, there's been some level of this archetypal pattern. And then the ability to see the condition as an inner psychological process. It's not going crazy. It's an evolutionary process. And that we are evolving in consciousness. We are evolving as a species. And we're in a very dark night right now planetarily because we have to make some changes and grow and shift, or our survival's in question. So in some way, we're going through a spiritual emergence right now on a planetary level. We're having to reevaluate what our priorities are, what's important to us. How are we going to tend to our lives in a way that is inclusive and loving and holding and honor the whole life experience? And that there's no conceptual disorientation, so you don't feel like you're going crazy, but you just feel like you don't know what's happening. You still orient to your daily life. You're able to cope for the most part with all the chores you've got to do, paying the bills, doing everything, but your relationship with all that changes very dramatically. And there's no brain disorder or physical disease going on that could be causing the symptoms. And there's not a history of psychiatric treatments or psychiatric care and illness. It's a total separate experience from having like an anxiety disorder, something like that. So a spiritual emergence can become an emergency. It can become a crisis. And the first way that it can become a crisis is that the people that they share it with don't believe them, or they think they're going crazy. And so they say, well, you better go see a psychiatrist and get some medication because hearing these voices means you're going nutso and I can't help you. So go get some medication. Or the person themselves doesn't have a framework to understand the spiritual opening. They may not have the language for it. They may not have any understanding of it because they've had no exposure to it, and it's all new to them, and it becomes very, very frightening because of it. And they don't have the emotional stability where they are developmentally, psychologically, or spiritually to know how to integrate the experience and move through it. And maybe they don't have the tools to help themselves with some of the effects of it. And we're going to talk a little bit about the tools that can help you with it.
Okay.
Yep. Okay.
Okay.
Somebody's got a mic on. Somebody's talking with a mic on. If your mic is on, please turn it off so we don't get all the noise in the rooms. There we go. Okay, so patterns of spiritual emergency are also something we'll talk about here. It's basically an episode of intense and life-disrupting transpersonal experiences. So here are some ideas of what might be some disturbing experiences. The first is having a near-death experience. Who's got a mic on? We're getting fallout here. Somebody's got a mic on. Diane, Laura.
It's from the telephone number, Holly, but I don't know who it is.
Yeah. Anyway, whatever's happening is causing a sound disruption, so please turn your mics off. Okay, so near-death experiences can be very, very opening in terms of a spiritual opening. All the research shows that after people have a near-death experience, they see life completely differently. They relate to death completely differently. Sometimes they have abilities that they didn't have before that are more intuitive psychic abilities. And then people who have a spontaneous or perhaps even a drug-induced out-of-body experience. I've had a couple of people through my hypnotherapy trainings have spontaneous out-of-body experiences where they're looking at themselves across the room. And for those of you who want to look into research of these, you can read the works, of course, of Raymond Moody. And for the out-of-body experiences, let's see, what's his name? Robert Monroe is an excellent person to read because he started having his own spiritual emergence through spontaneous out-of-body experiences and then made a whole career out of studying it, sharing it, educating about it, and offering experiences through clinical settings. And when people have an experience of cosmic consciousness, experience of unite, of how we're all one, and that they lose a sense of individual self and move into that oneness through an expanded state of consciousness. Or someone who has a psychic healing or physical healing and a psychokinetic experience can be an opening. Someone who sees life on a more mythological level, like I mentioned, the Bodhisattva vow. Or having a relationship to some of the effects of shamanic journeying, for instance, shape-shifting, feeling like you're an animal flying or a bird flying, or moving into other dimensions of experience. The underworld, the upper world experiences can open it. Emergence of Kundalini awakening, where you are feeling flooded with energy. There's an intensity of heat that moves up your chakras and sometimes can cause a lot of physical pain and disruption because the energy is not able to completely release. That can be worked with support. Emergence of a karmic pattern. I suspect that all of you who do past life regression therapy have seen over and over again how people have patterns that show up that are related to current life. And these patterns are here to be resolved this lifetime. So supporting people who have those awakening karmic pattern experiences with our work can be very, very supportive. Psychic openings. Psychics that are out of control because they don't know where their boundaries are can have a spiritual emergency. Past life, inner life, and birth memories that spontaneously come up for people can be very disruptive. In contact with aliens, angels, demonic entities, and the dead. Spirit attachments can cause it. I think one of you even texted about that or chatted about it. And people who have channeling experiences, where another energy moves through and communicates through one. people who have close encounters with aliens, UFOs, abductions, in contact with dead or spirit guides, and people who have an opening through surgery or childbirth. So these are all ways that a spiritual emergency can happen. It's very disruptive, very cathartic. So I wanted just to share about some clients that I have had the opportunity to work with and support. Because of confidentiality, I've changed some of the information here so that these are unrecognizable people. But the first one was an untrained psychic medium. And as a matter of fact, one of our colleagues referred somebody to me who was this woman who lived up in my area, and I began working with her. And she was very, very open, had no grounding, had no way of having boundaries between where she was and where she ended. And she went through a process of therapy with me, and then I referred her to someone for lower fee services over a long period of time, who was able to support her in learning about how to control her transparent perceptions that were just flooding her all the time. And she ended up going through my hypnotherapy training and all the energy therapy trainings, and now is working as a medium. She's incredibly talented as a medium. But before she got to that place, she was in a very crisis state in her life and just barely able to function because she was so wide open and so ungrounded and reading everything all the time from everybody. And she became a landing pad for entities because she was so open. That was definitely a spiritual emergency. And then there is a person who came to me who was driving home on a very quiet freeway in our area at 4 a.m, leaving his work. And he had a 3D vision of himself and a very cathartic experience in a past life where he was being killed. And he felt like he was being killed. He saw it and he felt it at the same point. And it was so intense for him that he stopped his car in the middle of the freeway. He had lost control of what was going on around him, totally got immersed in this vision, and he doesn't know how much time had passed, but he awakened from this vision, realizing that he had stopped the car on the freeway while it was happening. And about a day later, he showed up in my office wanting to do past life work. This totally shifted his sense of reality. He was very disturbed, obviously disturbed. I was disturbed for him. He had to get whatever was coming through this past life spontaneously under control and support through it so that he was able to ground himself and come back into this reality and integrate that experience in a way that supported his healing. That was definitely a spiritual emergency. And then I had a young man come in who was the son of a mortician. He lived up above the mortuary with his family, and he, through his whole childhood, would go down into the mortuary while his dad was working on cadavers and bodies, and he started bringing dead people home with him at night. They would attach to him, and then he would have all these friends and playmates that he'd work with. And it wasn't until he got to his middle teens, early adulthood, that he realized there wasn't enough space for everybody anymore. They'd kind of taken over his life. So his spiritual emergency was really about releasing his attachments to these people. And in some ways, he was attaching to them as much as they were attaching to him, and to come to terms with his own boundaries and his own sovereignty. But he was in a very scary place by the time he came for help because he felt it was just out of control. And then a woman who had a Kundalini opening and spontaneous past life memories after meeting her soulmate. That gets the Kundalini going sometimes when you are connected up with one that you recognize from another time and place for whom you have a deep soul connection. That was very disruptive and exciting on some levels. And then this was not a client, this was actually a neighbor of a friend who was a caretaker for one of her neighbors of an elderly gentleman who passed. She was very attached to this gentleman. And about a week or so after he died, she was in the parking lot at Safeway, bringing her groceries to her car in the rain. And her neighbor was standing right in front of her in 3D. And he communicated to her, thanking her for her help and her love, letting her know that he was fine. He was going to be just fine. He's glad to be with his wife who'd passed earlier, um, giving her love and honoring her for all that she'd done for him. And she was sort of nonplussed about this until she actually got to her car and started putting groceries in her car, and she turned around and he disappeared. So this opened her up to the whole realm of the afterlife, the whole realm of not being afraid of death. How she was a little bit freaked out for a day or two, and then she realized it was really a gift. She kind of worked through the anxiety around it. Was a gift to help her come to terms with his passing. And then the last subject I will share with you is a teenager who begins to use marijuana regularly and gets some bad marijuana that has probably some hallucinogens or some psychotic potential in it. And this teenager begins to see and talk with her dad's dead girlfriend that had just passed a couple of weeks prior to the starting of use of marijuana. And the girlfriend says, "Stop using drugs. This is a bad path to be on. I'm here to warn you. This is not safe for you. Behave yourself and stop this. And I'm okay. Don't worry about me." And that completely freaked out this kid, completely freaked her out. And she thought she was going crazy. I worked with her, helped her ground. She got some more talking with the dead hypnosis so she could communicate to the girlfriend more. And to this day, I'm in contact with this person. She's not using drugs. So that was her spiritual emergence. Okay, how do we support these clients? What can we do as practitioners to guide people, to support people, to educate people about this? The first and most important is normalization, to help people understand that what they're going through, other people have experienced. They're not alone in this, and that it's not abnormal. It's a part of the evolutionary process that we go through as humans in growing our consciousness and working through our karmic dances. We're here to dance and to educate them about it. And I've got a bunch of resources I'll share with you at the end to help with the education process. Maybe you'd like to educate yourself a little more as well. And knowing that they're not alone, to confer them to support groups or connect them to fellow experiencers. For instance, there's a group for people who have had near-death experiences that is very wonderful and supportive, because they can normalize it and talk about it and educate each other about it and learn how to integrate the experience. Then reframing to see the spiritual emergence as a positive thing. It's a sign of emotional, physical, spiritual growth and healing. And it's part of our evolutionary process. It's a natural process that we go through. It's not always acknowledged in our 3D culture, but it's becoming more understood and more acknowledged in our culture. When I was just becoming a therapist, they changed some of the diagnostic categories that are used for mental disorders in this book that we have, this big, thick book that we work with. And there suddenly became a category called a spiritual problem. It's the first time that the psychological world even recognized that people have emotional distress around spiritual issues. So the paradigm is shifting. Certainly the work of Stanislav Grof, whom I will talk about, who is really one of the spearheaders of this whole spiritual emergence concept, has made headway in the psychological community by bringing in a transpersonal perspective. And now it's even evolved beyond the transpersonal into an energy therapy perspective, that it's all on an energetic level now, that we're looking at crises and symptoms being caused by an energetic disruption. So how can we support people with exercises? Certainly teaching them how to ground, how to do meditation practices that balance chakras, how to have a sense of your own container energetically and to work with building that container and that boundary. And being in natural surroundings in nature can be very, very supportive. You know, people talk about being a tree hugger. Well, there's really something about that. There's really something about grounding in the earth and having that stability connection in your life more strongly accessed. And then, of course, diet can help, eating grounding, healthy foods, avoiding caffeine and sugar, which can create more anxiety in the system. And sometimes people have to reduce their interpersonal and environmental stimulation. If they're picking up everything around them because they become more sensitive, maybe they have to slow down their life a little bit. Take time for more self-regulation, take time for more quiet so that things can calm down and integrate instead of keeping the drudgery and the day stimulation going at a high level. Avoiding loud, violent, stimulating media. Watch positive things on the TV. Temporary suspension of spiritual practices. Sometimes you have to stop your meditation practice or stop your yoga practice for a while so things can kind of settle and calm down. And reading spiritual materials might be overstimulating as well, because they're recognizing themselves and maybe the evolutionary process that's being written about. Encourage creative therapies and expressions. This is, earlier, Janet was talking about sand play therapy, and I've actually discovered ways to do sand play therapy for spirit releasement, for past life therapy, for helping people have more boundaries. And these creative therapies get people in a more physical, grounded connection to their body, which is really helpful. And then, of course, we can offer them a compassionate, understanding, therapeutic container while they do their exploration and their integration work. And you would probably want to consider at some point helping the client work energetically with a body worker or a Reiki practitioner or someone who's sensitive to energy that can help actually work with the energy system that the client has going on. And then evaluation for medication if it seems appropriate. And that's not something, unless you're able to diagnose and prescribe, you would need to have someone who is a medical doctor or someone who can prescribe who is spiritual emergence aware. So they can do an assessment that's appropriate to a spiritual emergence client. And there are some ethics that we need to talk about working with these clients. The number one is to know and honor your own limitations to help. And depending on the laws and ethics that define your profession and your practice, you may need to make referrals for clients who have needs beyond your scope of practice. Refer to other professionals that have skills and training beyond what you can provide. And then it's always helpful ethically to expand their resources so you can recommend to clients classes, workshops for intuition development, parapsychology classes, enhance their energy boundary classes, support groups, body work, self-help, energetic healing like EFT and Reiki, so that a person is empowered to get community access and other helpers who have other levels of skill and competency. And when you work with these clients, use the tools that you share with your clients for your own self-care. And if you need care beyond what you can provide yourself, reach out to other practitioners for care. Support your own healing and your own growth. Those of you who've been with people in spiritual emergence or emergency know that you too can get activated by just being with them at times. We're all connected. So energetically, if you're sensitive, you might be feeling some expansion going on yourself and need some support and care. And really importantly, remember that you've chosen to do this work that you do and acknowledge the part you play in the healing of humanity and our evolution of consciousness. This is really, really important work that we're providing because it is on the edge of our limitations here in this 3D world, expanding into our next level of evolution. Continue to read, take classes, work with mentors, and join in community with other practitioners and spiritual sojourners. Expand your awareness of your connection to the quantum field with other light workers. And that's what our organization is providing for each of us now. Since we've expanded what our opportunities are together, we have much more capacity to connect with each other in these ways. So sometimes these symptoms can be confused with pathologies. And these are some of the symptoms. A person in spiritual emergency is going to have difficulty communicating about one's experience because it's ineffable. It's not something that they can describe in words because there are often no words to describe it. And that's difficult. They don't feel seen or heard because they can't express themselves. Also, there's sometimes disorientation and less interest in workaday life. All of a sudden, the meaning that they had in their daily life is gone. There's something new that they're focusing on that's still undeveloped, ungrounded, and new. So often there's inactivity or anxiety and depression that comes with a spiritual emergence. And dissociation, which is transitory and needs part of integrating one's experience. If someone is in a psychotic state, the dissociation doesn't necessarily feel like it's transitory. It's constant or it's periodic all through the psychotic process. These phenomena will subside after a spiritual emergence, where is a chronic psychosis, they do not. Now, for those of you who are trained clinicians in psychology, I've got this little graph here for your look at later when you get the video, if you want to check it out, to look at some of the differences between a spiritual emergence and a psychopathological issue. For instance, a Kundalini awakening might have the symptoms of streaming energy, tremors, sensations of heat, cold, spasms, and violent shaking, involuntary laughing, crying, unusual breathing patterns, and lights or visions, which could easily be confused with a manic syndrome or a generalized anxiety disorder. And I'm not going to take the time to read all this because it may not be relevant for all of you, but if you are a clinician who can diagnose, this might be important for you to look at when it's posted on YouTube. Also, I'll give you a book where you can access this information as a reference. And here are some resources for you. Books by Stan and Christina Groff. Stan Groff is a contemporary psychologist who is renowned for transpersonally oriented psychology. And he began his journey here in the US after escaping from a communist country on skis. He skied his way to freedom, came to the US, became licensed here in the US, was already a doctor. I think it was Czechoslovakia or Yugoslavia, I forget where. And he started doing research on consciousness through LSD studies. He would give LSD to people and then do research, finding out what experiences emerged. And through his work, he mapped out different levels of consciousness. And through hypnosis, those levels of consciousness can also be accessed. And he had to stop the research because LSD became an illegal substance, and he developed subsequently a technique he calls holotropic breath work, which is a hypnotic process using sound, music, and breathing. And he continued his research of the different levels of consciousness through the holotropic breath work. And he is the person who came up with this concept of spiritual emergence and spiritual emergency. So this book, The Stormy Search of the Self, or Spiritual Emergency When Personal Transformation Becomes a Crisis, are very basic primers about this work and really helpful for any clinicians who want to go a little bit deeper with what I presented today. And then Emma Bragdon, who was a student of Stan Groff, has become renowned for her work in spiritual emergence. And her books are basically the books that I took this information from today that I'm sharing with you. They're both excellent. The Call of Spiritual Emergency, From Personal Crisis to Personal Transformation, and a source book for helping people with spiritual problems. Excellent resources for you. And if you're interested in more the mysticism behind this, there's a fabulous book that's been very life-changing for me by Satpram called Suryo Bindo, or The Adventures of Consciousness. And this book is wonderful for understanding the different developmental stages as humans we are going through with our consciousness expansion. He's done a beautiful job of categorizing the stages, describing the phenomena that happens, and he himself went through all these stages before he passed, so he spoke from personal experience. It's a big book, but it's very readable, and I highly recommend it if you're interested in more the mystical side of this. And then in terms of resources for your clients, the Spiritual Emergence Network, any of you can join this organization and become providers. I've been a provider since 1980s, where I get referred people who are going through spiritual emergence, specifically for past life work, also for spirit releasement. And you can go on that website, which is spiritualemergence.org, and look at the practitioners that are available as backup support for your clients. And then I mentioned earlier the International Association for Near-Death Experiencer IONS, which is a great organization for anyone who's had a near-death experience who wants support. And then there's also an organization called the Kundalini Support Network, which was started by someone who was also trained by Stan Groff. This is a Bay Area organization. And she provides support as a practitioner, but she also has a lot of other resources she can refer to you. And then most recently, I saw a great movie on Gaia TV that's called Crazy Wise, about a young man who went through a spiritual emergency, who got beat up through the medical system, who came out on the other side through the help of some mentors and some meditation practices and a meditation community to integrate his experience and be able to move forward in a fairly healthy way. So it's an inspirational movie, and it's a really good depicting of what happens when somebody goes through this kind of an opening. And then I will share some of my own personal resources. These are all hypnosis techniques. They're all in my book as well, but I have specifically created some for spiritual oriented clients that have tools and techniques for self-care to help people who are going through these experiences learn about grounding, work with their dreams, do some past life, inner life, or spirit releasement work. And they're available on Spotify or Amazon if you're interested, or you can refer your clients there if you want. This is called Blessed Are You Who Bear the Light. Blessed are you who bear the light in unbearable times, who testify to its endurance amid the unendurable, who bears witness to its persistence when everything seems in shadow and grief. Blessed are you in whom the light lives, in whom the light blazes, your heart a chapel, an altar, where in the deepest night can be seen the fire that shines forth in you, an unaccountable faith, in stubborn hope, in love that illumines every broken thing. That's by Jan Richardson.